Hold on, Kurt, hold on, we're not live, and I'll start.
Got it.
Okay, good morning. Welcome to the Thurston County Board of County Commissioners Work Session, Thursday, August 4th, 2022. It's 9:39 a.m. We're here to discuss the Veterans Program Briefing. We have half an hour slated, getting a slightly late start, so we'll take our full 30 minutes here to address this. For virtual public attendance, you can follow along on the Thurston County YouTube channel. My name is Ty Menser, Vice Chair of the Board. We have Commissioner Gary Edwards to my left, Assistant County Manager Robin Campbell. I'm going to introduce Interim Director of Public Health and Social Services, Kurt Harden, who will introduce his team members that are participating in this briefing. Go ahead, Kurt.
Okay, thank you. Good morning, Commissioners. Kurt Harden, Interim Director for Public Health and Social Services. With me today is Mark Moffett. He's the Program Manager for Veteran Services, and his staff, Ashley and Lanice. And they're going to present to you what our whole program for veterans and all of our outreach that we do. And they've got a slideshow that they're going to present as well. And they're well versed on it. They've got a lot of experience in this. So I'm going to let them take over. And Mark, I'm going to let you take the lead on that, and then have everybody else go in and chime in for their piece and parts.
Okay, great. Thank you, Kurt. Good morning, Commissioners. Do you have the slides? Are you showing them, or should I share my screen?
Jamie can, Clerk of the Board can do that for you if you want to prompt her through.
That would be great.
Okay.
Okay. So today I am Mark Moffett, the Social Services Program Manager. With me is Lanice Milam. She is my Community Program Manager. So what she does is she oversees the Veterans Program, but she also has a development of disabilities aspect. She's the Quality Assurance Specialist for me as well. So 10% of her time is to oversee the Veterans Assistance Program. And then Ashley Redlewski, she oversees two veteran programs, the Veteran Assistance Program and also the Veteran Case Management Program through the TST. So 80% of her time is dedicated to Veterans Assistance Program. And so today, what we're going to talk about is Ashley will start. She's going to talk about the two programs that she oversees, and then she's going to compare it with a Washington State Department of Veterans Affairs program that is similar to ours, but the requirements are a little bit different. She'll go into that, but they complement each other well. And then I'll talk to you. I have a few graphs to show you that shows you where our direct service money is going, the amount of veterans that we've assisted in the county, and then talk a little bit about our shelter program. And then Lanice will talk about where we're going this year and some of our goals. And then I'll come back, and if we have time, I really want to touch on the impact that the Lacey Veterans Hub is having on Thurston County veterans. So with that, go ahead, Ashley.
Technology.
You there, Ashley? Can't hear you.
Okay.
Yep.
Can everyone hear me now? Sorry about that.
Yes, ma'am.
Okay, perfect. All right. Good morning, Commissioners. I apologize for that. Have a little mic issue, but our Thurston County Veterans Fund is for our indigent veterans in the county and their family members. We provide financial assistance specifically for these family members for living expenses, utilities, rent, past due mortgage, those types of emergency expenses for them to live. We also provide the assistance for TST, which is our Thurston County Veterans Case Management. This is a short and long-term case management. I provide case management, financial resources, temporary referrals, and advocacy for these veterans that are justice involved. Usually we serve between 7 to 10 veterans per quarter. And then the next we have is our Veteran Innovation Program. As Mark had mentioned, this is a program that we have at the Lacey Veterans Hub. It is not our Thurston County program, but it emulates our county assistance fund that I work closely with through the WDVA, which is the Washington State Department of Veterans Affairs. We provide assistance to veterans, and if they're still needing additional financial assistance, we refer them to this program. They assist a veteran on a one-time basis, and it's only for post 9/11 veterans. So anyone that served after September 11th, 2001. And these veterans at times need more assistance than what we can provide. So we work closely with the additional service members and resources. And that's all I have. Thank you, Lenice.
I'll go ahead and, if I may, just elaborate a little bit. There are a lot of programs out there for veterans. You have troops to teachers, boots to shoes, helmets to hard hats. A lot of these programs complement each other, and some of them replicate what others are doing. But some may not qualify in one program, but can in ours, and vice versa. So we always refer. If we can't help them based on our requirements, we make sure that we send them to somebody that may be able to. We never let a veteran down. We always refer them to somewhere else if our program isn't right for them. Slide. Thank you. So here are the direct services over the last 5 years, 2018 to 2022. And there's a few takeaways that I'd like for you. Our numbers, you know, obviously they're down. We don't have a lot of people coming in for assistance. You can see in 2018, the numbers, the expenditures were very low. So in 2018, we changed policy. I think at that time, you know, half of the board was probably part of that. And so we were able to expand our services. We were able to increase the amount of funding that we could hand out to veterans. And then you see a spike in 2019. So the policy seemed to work. And then 2020 came along, and you know, I don't have an explanation for it other than COVID. You know, COVID in all of our services, it seemed to have had dropped. Seems like it had the opposite impact that we thought it would have. We thought more people would come in for services, but they dropped. And so in 2020, we changed our policy again for the second time in 2 years to include more veterans and to help more. And then you see in 2021, we're getting more people coming in, and we're able to give out more money. And then this year, we're doing much better than we did in the last 2 years. We're almost on board with all of last year, only halfway through. So this year, we're also going to submit another change in policy so that we can add more services and help more people. Any questions on this slide before I go forward?
Yeah, off to the left, that's the dollar amount then that you're expending in total?
That's correct. And I do want to make one caveat to this. So this, with the exception of, 2019, you see the spike. We included the rental assistance to the hub in that graph. I took them out of the other 4 years. Unfortunately, I missed that year. So that spike is not as high as you're looking at it. I just wanted to make sure all the years were equal, because not every year we give that money to the hub. So I wanted to make it apples to apples.
And how about numbers that you're serving?
Yeah, that's the next slide, Commissioner.
Oh, okay.
If you guys are ready to move on. Okay, slide please. So veterans served. So in 2019, we were able to help a lot more. 2018. And then we did change policy, and we were able to help even more with that. If you see that, just roughly 48 or so in 2018 and close to 60 in 2019 that we were able to help. That's the green line. The blue line are veterans that we weren't able to serve through this program. And there's three big reasons for that. One is that they're over income. Two, the characterization of discharge. They need to have either an honorable or general under honorable conditions to be served through this program. And then the third, and probably the largest category, are those that don't return for service. They may initiate, start paperwork, or come in to talk to Ashley, but they don't return. And then Ashley will reach out to them 2 to 3 times. If there isn't any contact, then we stop contacting them. So that's the largest portion of those that we can't serve are the ones that don't come back. And then 2020, you see another drop off, and we changed the policy again in 2020. In 2021, it wasn't much different than 2020. There were a few less. But then you look at 2022, and now our numbers are looking almost identical to all of last year, and we still have nearly half the year to go. So the important thing to take away is the trend is coming up, not as much as we want. But if you add those two columns, we're not getting a lot of veterans coming in for service. And that's why we are doing a lot of community outreach, and Lanice will talk about that later, to make sure that veterans know, this program is available to them. Any questions on this, commissioners?
So there's 6 months of activity on 2022.
Yes.
Okay.
Commissioner Mejia?
Yes, thank you. Mark, I'm wondering about maybe, is it the scope of services that maybe we're offering help with, and that's why that it's not broad enough for people to come in and request that help? Do you think that is something to do with why we're seeing, it's great that we're kind of catching up to kind of our previous numbers, but I'm just wondering about that scope.
You're right, Commissioner Mejia. That's why we're changing our policy. You can compare us to different counties. Each county has, different populations. A similar county to us would be maybe Kitsap. Kitsap has two big differences than us. One is the types of services they offer, things that we don't offer, at least not as of yet. So we don't offer appliances, medical, dental. There's several on there that they offer that we don't. Bus passes, gasoline. Those are the type of things that we don't offer, but they do. The other big difference with Kitsap is they have a county employee, much like Ashley, that performs those services, but they contract out the majority of their services. So they have the county employee, but then they spend $125,000 to Kitsap Community Resources to actually divide the money up in the community. So they spend more, but they are giving out a lot more money as well, and they're seeing more veterans come in. So we are trying to expand. We're not going to be identical to Kitsap, but we are trying to expand the services that we're offering and the amount that we can give to them, because housing has increased a lot, and although we've increased the amount we can give out, it's just not on par with the way the cost of living is. Does that answer your question? Okay.
Yes, it does. Thank you.
Okay, thank you.
Just maybe a follow-up to that. Mark, when we're giving out our help, do we help them fill out the forms that are needed, or do we just hand them the paperwork and send them away, or what do we do?
Ashley can respond to that.
Yes, thank you. I do. I actually fill it out. So they provide the information to me and I fill it out and then go over the document with them and then have them sign it. And so that they are of understanding what it completely consists of. So it's not something that they just do online or, they pick up. I give them a list of documents that we require to determine their eligibility. And then once they gather all of those documents for us, we then sit down with them, go over the information. I fill out the application, go over the application and have them sign it.
And then one final thing there on the veterans served, those columns of green and blue, so they come in to get help is the green column, I take it. The blue column, is that folks that are not included in the green column at all, but were then denied because of one thing or another? So I don't know if I'm articulating.
Yeah, if I can jump in, Ashley. So I can tell you for 2022, there were, I think, how many on there? 13, somewhere in there, 13 people. 3 of those were denied. The other 8 didn't come back. And Ashley wasn't able to make contact. So the 3 this year, I'll just really quick, that weren't able to be served. One was $3,000 over income, even with our expand, because we do that's something I should say. So our county, we are able to do 200% above the poverty, the federal poverty guidelines, whereas most counties in the state do between 150 and 175. So we've expanded that to 200%. But this particular person was even $3,000 above that. And then one didn't complete basic training, so that doesn't meet the criteria for this program as being a veteran based on the RCW. And then there was another one, I think, was that one over income too, Ashley? Yeah.
Yes. Yeah,
Okay.
that one was over income with spending habits as well that were not. Yeah, we refer to financialist counseling and mental health.
And that's an important point. One of the challenges is that we ask for bank statements because we want to make sure that everything's legit. And we've seen it on numerous occasions where somebody's going to the casino a lot, and that's not really a good place for taxpayers' money to subsidize. So what we do is we don't just drop that. We don't drop that veteran. We refer them to counseling services. At the hub, we have the VA there with counseling services, and then we also do financial counseling. So it's really a broad spectrum of what we can do for them. A lot of times they just don't qualify for this particular program. So only 3 have been turned away because of characterization of discharge or because of over income.
And may I real quick, Mark? So one of the ones that was over income, we asked them to give us a situation. We understand people have hard times. And so that was one of the things that we ask if they don't qualify. We file a waiver with our Veteran Advisory Board. It was denied, but we try to ask the veteran situation to have a better understanding and see if, we can provide that assistance. We understand she's 3,000 over income or he's 3,000 over income, but is there some situation that put them behind significantly? And we could not get a actual accurate accounting for their situation, and then that's why that person was denied.
Yeah, we don't do it just between us. We go to the advisory board and let them make that determination whether or not they qualify for a waiver. Yes, Commissioner Mejia.
Do I still have, that probably was just left up. I
Oh,
do not
okay,
have a
sorry.
question.
Okay. Any other questions on this slide? Okay, thank you. And we do have this longstanding contract with Catholic Community Services to provide shelter for veterans. And it kind of fluctuates. Some years they will provide 2 bed nights, so 2 veterans each night can go in and get shelter. This year they've gone up to 3 bed nights. The cost per night hasn't gone up in a few years, so they're really providing a great service. And I want to reiterate that this is a contract for services. So we reimbursement for services. So each quarter, at the end of each quarter, they'll submit an invoice with the number of veterans that they served that quarter. They'll supply their DD-214, which is their discharge papers from the military, and they also itemize the nights that they've spent there at the shelter, signed by the veteran and by the case manager there, and then we review it and making sure that the DD-214 meets the eligibility of the RCW. Once that's all in place, then we can reimburse them for services. So this year, so as you can see the trends, again, 2020, I don't have an explanation for it. It seems like that would be a year that we would have more services being given, but it dropped off. This year, we've only received 1 quarter invoice from them so far, and that was 3. We know that they have another 5 from the second quarter that they've already alerted us to. So we're going to exceed the last 2 years by the end of this year, serving veterans at the shelter.
On that one, Mark, so the veteran, like we reimburse up to 3 nights there for a qualified veteran.
Up to 3 nights, yes. Oh, no, up to 3 bed nights. So it can be 3 veterans each night. So every day of the week.
And for
We
how
do,
long can they stay? And we would still,
by our contract, we say that the majority of the veterans should not be over 90 days for the calendar year. And so that prompts Catholic Community Services to try to get them either into transitional housing or into a permanent housing. And they've done a great job with providing that service as well, which isn't in our contract.
okay, so I get that. And then the missing piece of this for me is, how do you get connected to Catholic Community Services Drexel House? You need to be referred from somewhere else? Can someone walk in the door? How do you get there?
It's still coordinated entry. Ashley, you want to touch on that?
Yes, I can. So it is coordinated entry. However, we do have referrals every Thursday at the Lacey Veterans Hub at 10 o'clock. We have a VHOG, Veteran Housing Option Group meeting. So myself, Catholic Community Services for the SSVF, which is Supportive Services for Veteran Families, our WDVA counterparts, many different resources that are available that provide some form of housing assistance and case management. The HUD-VASH through the VA, which is basically a Section 8 housing voucher for veterans. Those case managers are there. They do intakes. And so we have many different people that provide intakes and information and referral services into the Drexel and other resources and housing in the county.
Okay, thanks.
Anything else? All right, slide please. And this, I'll let Lenice go over this.
Good morning, commissioners. So the first thing that I'm going to speak about is the pilot employment program. Thurston County Veterans Employment Initiative basically identifies one veteran per quarter that is unemployed or underemployed and in danger of losing their home. So the Veterans Assistance Program will support rent, utilities, and childcare for up to 3 months with the veteran that will focus on employment with some of our contracted providers. Currently, this was already approved by the BoCC, and we should have someone that's going to be entering into our program on October 1st of this year. This program is basically focusing on making sure they're stabilized, that they have an ability to take care of themselves after we assist them. Any questions regarding this pilot employment program?
How far into the program are we? How you started when? And
We should have our first person that'll be joining us on October 1st.
Okay.
Yes, sir. And the next Veterans Assistance Pilot Program, this has not officially been approved yet. The advisory board is still working on some details along with Ashley and myself. This program is going to provide regular fixed monthly financial assistance to veterans who meet the eligibility criteria within a 12-month period. The VAPP, which is the initials of that, the goal is to assist veterans with basic subsistence needs like food, fuel, and other reoccurring monthly expenses. It differs with the other program that is more of a employment initiative. This is a Veterans Assistance Program. Any questions regarding that?
When will we get a final briefing on that?
11/1 is my launch date for that.
Okay, the committee though hasn't got that hammered out yet?
Not yet. We're still working out so many of the details, making sure that we can provide the best services possible.
Thank you.
Is this like a one at a time, or how is it? What's the scope? How many people are going to be trying to launch in this VAPP pilot?
If I can jump in, Lenice. So last year or early this year, when we had talked about this with the commissioners, we had said we want to start with one veteran each quarter because we don't know what to expect. This is different. So this one's coming to you by November 1st for approval. And I think that the advisory board wants to start out with between 5 and 10 with this particular program. Sorry for the confusion.
Perfect. Yeah, that's what I was trying to get nailed down. Thank you.
Thank you. And so the The next item here is the policy changes. We are looking to increase the maximum amount that will be given to each veteran to allow flexibility for veterans when obtaining assistance. We want to keep in line with the current cost fluctuations and cost of living in Thurston County. Ashley and myself have been looking at increasing the burial cap. We've also looked at increasing the amount that a single veteran and a family veteran can receive from our program. We're also looking at just small details to make things a little bit more seamless for veterans when they come, so that we can be able to assist them the best way possible to service our veterans in the community. Any questions regarding those policy changes?
No, we're good.
And community engagement. So I'm really excited about this. We're going to be collaborating with local businesses that veterans frequent. As Mark stated earlier, we're offering services to veterans to help them. We want to get to their face and be in front of them and be able to provide them services on not just coming to the hub, but on a human level, seeing them out in the community. So we're going to be looking and reaching out to businesses that service veterans, that sponsor veterans, and also attending countywide venues, reaching out to veterans in the community on their level, not just expecting them to know what to look for, but being there as a face in the community. Any questions regarding that?
Nope.
Okay. Slide, please. And so just to reiterate some of the goals for next period. So increase community engagement, because that's really where we see that we're slipping. We're not getting the veterans through the door to apply for the position. So we really need to get that out to the community. Changing policy, making sure these initiatives start, because I think that's going to have a large impact on our most vulnerable veterans in the community. And then also, some of you may remember the stand down that we've had in the past. The last one was 2019, and it stopped because of COVID. And now it's difficult to get back off the ground because we don't have the armory downtown anymore that hosted this event. And there's a lot of logistics that go into it. So we're looking at hopefully doing something this year on a stand down. At a stand down, we provide employers. We do interviewing with employers. So the employers have to have a job ready to go. And it's not just in the future we may be hiring. They have to have a current position available. So we do that. We also have free haircuts. We do a lunch for them. We provide I don't know what you would call it, urban survival gear, I guess, for especially the homeless folks. So there's a lot that goes on in that, and a lot of logistics that have gone away because we don't have the armory anymore. So we're looking for another location that's convenient. We bantied around the fairgrounds, cover your earmuff, Kurt, the ECC, but those places are all really remote, and it's difficult for homeless veterans to get to. So we do want to do something on a smaller scale this year. Madigan, Anna. Oh, and then we're also Ashley and Lanice are gonna reach out to JBLM, especially when soldiers are leaving the service, letting them know that we're available here in Thurston County. And we're also at the Madigan. We're going to post our brochures and flyers at the Madigan Annex, the place right here next to us at Lily Road that serves veterans medically. That's all I have on the goal part. I know we don't have much time for Hub. Do you want to go into questions? I think I'm down to 2 minutes right now.
I would.
Oh, go ahead.
Well, we have an hour and a half slated for Commissioner check-in. I would be willing to sacrifice some time to hear what you have to say about the hub myself. Is that okay?
Yes,
with my teammates? Okay, go ahead. Commissioner Edwards has a question.
Mark, do you do any comparisons, or do you review other jurisdictions, what they're doing, and see if we're missing the boat anywhere, or this is working here, why don't we try it, that type of thing? I know Kitsap's been referred as a comparison. I know it's been sent in information. I just wonder how that works or fits.
Prior to COVID, I was the chair of an ACHS committee for veterans. And I brought in as many of the counties as possible with a VAP program. And we talked about that. We went into the details on what the definition of a veteran is compared to the RCW, and talking about the services that we offer. A lot of the smaller counties can't offer nearly what we're doing. Similar sized counties, I think there's one or two that actually contract their services out, like Kitsap, but at a much larger expense than what we're doing here. So we do monitor what's going on. Clark County as well. Whatcom, I've had a good relationship with her up there. So we do compare, and that's why we are changing some of our policies to expand the services that we can offer.
Okay, thank you.
Okay, Jamie, could you put up the hub slides? Now, Keith Looker is the manager for the Lacey Veterans Hub, and he does a great job in presenting this. He knows all these programs inside and out, and I can only touch on the very surface of it. And I'm happy to schedule a different briefing with Keith when he's available. He just wasn't available this morning. Slide, please. So here, these are the demographics for our county. We have about 32,000 veterans in our county. It's a great place. Purple Heart County back there. It's a great place for veterans to live still, and we want to reach out and continue to help them, support them. And so the Lacey Veteran Hub is actually a hub for veterans with 80 plus services that they offer. Slide, you can go 2 slides. So this is kind of the gamut of the services that are offered there. Housing, they have, like Ashley mentioned, they have the VHOG, which is the Veterans Housing, I'll just say group, since it's another acronym that I'm not familiar with, but they meet every week to discuss housing and those that are about to lose housing, the homeless veterans. So they talk about it every week and try to get them into housing. They have nutrition and counseling. They have, like I said earlier, the Veterans Affairs, they have I think they have 2 or 3 counselors that provide services out of the hub. We also provide legal. And here's another difference. We have one of our advisory board members, Matt. He is an attorney, and he donates his time at the hub to help veterans with various issues. And that's free. He doesn't charge anybody. Whereas in Kitsap, they have a contract for $50,000 a year with the Northwest Justice Project, and they pay for those services. We may in the future want to do that, but right now it's something that's provided free through the hub. We also have financial counseling, employment services. We have employment services out of there, and also veteran benefits. So if somebody wants to apply or increase their veteran benefits, there are veteran service officers that work out of there from the Veterans of Foreign Wars, the DAV, anybody else, any other service groups?
American Legion is there as well.
Okay, so they work out of that office as well. So any questions on services?
I mean, I have a question, just, you might get to it, but, what, if you're a veteran that's kind of in a hard spot, it's always felt to me like, because I've toured the Veterans Hub and been super impressed, and I know we contribute to that, it's like, why wouldn't they just go right there? Like, why would they come to one of our programs when all this stuff is kind of integrated right there at the hub?
Well, I'm sorry if I didn't put that out in the beginning. We're integrated in there as well. That's where Ashley works out of.
Oh, okay.
She has her own office there. So if she can't help somebody, she walks them over to one of the other programs, and vice versa. They'll bring them over to her.
So if somebody wanders into PHSS on Lily Road, you're going to send them to the hub because that's where they'll get connected to the county's stuff that we just went through?
That's correct. But I'm here at Lily Road too. So if they'll usually call me downstairs, and then I can talk to them directly to find out what services they need, and then I can either help them here or refer them over to Ashley.
Perfect. Thanks, Mark.
Yep, you bet. And then slide down to 7, please. One more. Yeah, right there. So this is how it operates at the hub. There's only 1.5 full-time employees. It's Keith and is it Shane? Shane. So he's a half-time employee, and they have a lot of volunteers, 32 volunteers, and you can see the hours. Over 7,000 hours are donated at the hub. And then I'm sorry, I'm covered up. Yeah, and so it looks like they're going to exceed that. The volunteer hours, and I think the majority of those volunteers are either service veterans or their family members that you want to give back and actually help out the community.
Yes, yeah. So they are the volunteers at the front desk. Shane is the volunteer coordinator there. And then all of the veteran service officers from the DAV, the VFW, and the American Legion all volunteer their services there. I of course am a paid employee that operates out of there, and so does WorkSource for the employment security, but basically every other resource that's there are volunteer hours.
Okay, and 2 more slides, please.
Say, Mark,
Yes.
before you move on there, are we back to walk-ins and such at the Veterans Hub? There for a while, it was closed down, due to the virus.
That's correct. Yes. I think all the partners are back. There's about 102 partners that work out there on various days, and they're all back to normal, I believe. Yep.
Thank you.
Yep. One more, Jamie. There you go. So here's what 2021 looked like at the hub. So people going in to see a service officer, 3,300 different appointments. Mental health counseling with the VA, 1,700. Legal assistance, Matt looks like he helped 200 or had at least 267 appointments. So you can see that there is a lot of activity going on at the hub, and as you touched on, Commissioner Edwards, it's all in person. So they are coming in and taking advantage of all these great services that they've coordinated there. Questions? Okay. Next slide, please. And this is as of this year, so not even half, or yeah, right at half a year, and they're going to exceed what they did last year with appointments. So even the hub saw a drop off in 2020, 2021, and they're seeing the trend come up. And slide, please. So they are seeing an increase in customer service through last year. And so Ashley, can you tell me about this? 76% of customers reside in Thurston County. Do they also offer services to outside the county?
So yeah, a lot of times because veterans are requesting veteran benefits or through the VSOs, the veteran service officers assist with filing their VA claims and benefits for VA disability. We have veterans that come up from Clark County, from over Pierce County. We've had people come from Longview, Mason County, all these different counties, because the hub is very well known for their veteran service officers that provide these assistance for benefit claims and having a good outcome. And so 70% of the individuals that come into the hub are Thurston County residents, but we have obviously quite a few that are outside the county that seek assistance. So some of those numbers, though they come in maybe for financial assistance or VSO or work employment, they may be outside of our county.
Yeah, then not every county has a hub. It's very rare. It's very rare to see a hub, and definitely not one that you're going to see like this. And that last bullet point, VA benefits and employment programs brought in $3.8 million into the community, and I believe that number represents the veterans benefits. So the veteran service officers who apply for benefits on behalf of the client or the veteran, this is what they received, and it becomes available for them to spend in the community. And I believe that's what that one represents.
Mm-hmm.
And that's all I have on these slides. Again, I'm happy to schedule a different meeting when Keith is available with you guys, and so he can go into detail about, you know, all the great things that are going on at the hub.
Commissioner Mejia, any questions?
Great presentation. No further questions. Thank you.
Thank you.
Sure. Mark, on the partners that you're referring to, there's 100 of them. Is there a list of those partners, I don't know, available, or, well, I almost have a thank you list or something?
Yeah, absolutely. I can get that to you. Keith has that. He rattles in our advisory board meetings. He'll rattle those off, and it's a very extensive list of people that come in and help and serve the veterans. Yep, I can get that to you.
Thank you. No, good presentation. Thank you.
Okay, very good. That'll wrap up this briefing. It is 10:19. I'm going to suggest that we convene at 10:30 for our commissioners check-in, take a quick break here. And thanks to Mark, Kurt, and Denise, and Ashley for your presentation today.
All right. Thank you. Thank you, Commissioner.
Thank you.
Very good.